the Centers for Medicare and Medicaid Services Center for Clinical Standards and Quality brings you CMS QI Voices, an audio series that gives you a closer look at the projects and people who are improving healthcare quality and outcomes. These brief conversations include detailed show notes for even more insights into the process behind healthcare quality improvement and how you might adapt these to your own organization. In this series, CMS explores how nursing homes and Quality Innovation Network quality improvement organizations have worked together to tackle challenges related to COVID-19 vaccination, infection control, and the use of therapeutics to improve resident outcomes. Let's listen in.
Welcome to CMS QI Voices, Improving COVID-19 Outcomes in America's Nursing Homes. I'm Colleen Fry, Acting Director, Division of Community and Population Health, Center for Clinical Standards and Quality at the Centers for Medicare and Medicaid Services. Today, I'm joined by Cassandra Thornton, RN, LNHA, Executive Director and CEO of Kindred Hospital, Greensboro Subacute Unit in Greensboro, North Carolina, and Lisa Davies, CPHQ, LNHA, RDLD, Quality Improvement Initiative Manager at Alliant Health Solutions in Atlanta, Georgia. Ms. Thornton has worked for Kindred Hospital for more than 35 years and has held many roles, including nursing educator and director of nursing and administrator. Ms. Davies is Alliant Health Solutions Quality Improvement Initiative Manager. She has more than 20 years of experience in long-term care, including facility administration and implementation of quality improvement frameworks. In today's episode, we will be talking about using motivational interviewing and education to address vaccine hesitancy and increase resident COVID-19 booster rates within a high turnover population. Welcome. Thank you both for joining me. Cassandra, tell us about your facility and the population you serve.
Yes, thank you. Our facility is located within Kindred Hospital, Greensboro, LTAC, and we are a 23-bed skilled nursing facility, which is a subacute. It's kind of a step down from the hospital, and we're best known for our work around ventilators and the weaning program that we have around that. We have a few different services that you would see that we provide wound care and the wound vacs, chest tubes, IV antibiotics, blood transfusions, and we take care of more of the clinically complex patients, and those are the type of patients that we serve.
Lisa, can you describe the root cause analysis you conducted and the challenges that were identified?
Yes, thank you. We utilize a modified fishbone that is a template at Alliant for a process for our root cause analysis. It actually breaks up contributing factors into 4 categories, looking at environmental factors, staff and people factors, rules or policy factors, and then equipment and supplies. The fishbone really helps to identify all of the contributing factors so that actions to overcome barriers can be prioritized. For example, it was identified that having a high volume of short-term patients contributed to their low booster rate. But as we completed the root cause analysis, digging a little deeper below that surface, we really identified the underlying issues that was within that surface cause, looking at vaccine hesitancy due to temporary location of care and mixing of manufacturers. Once we were able to identify, Alliant could share resources and tools that were specifically addressing those concerns. For example, providing information on the safety of mixing manufacturers, as well as information on the value of boosters in the community setting, as well as tools to implement motivational interviewing.
Cassandra, can you describe how you set your quality improvement goal and developed an action plan to overcome these challenges?
Yes, we started with our huddles and committees around that to develop our QAPI plan. And in doing that, with interviewing our staff and residents, we found that some of the problem as far as hesitancy of vaccines were that people just didn't have a good understanding around that. So we worked with our medical director as well as attending physicians that we had that were very involved around the vaccinations. We developed the clinics. One of our attending physicians were head with leading some of those clinics for us. And so we worked with Alliance Healthcare as well with some of the information and education that they provided for us around the boost program. In the committees, we provided additional education around the clock. We posted things all over the floor. We educated our residents, our staff, and families, and around the facts with the vaccinations. And we were able to improve our rate through that and our interdisciplinary team. So it was all staff on board with that, making sure that we got the importance of that protection, not only for our patients, but for each of our staff members as well.
Thank you. Lisa, can you describe the educational resources that you offer to all nursing homes in your region, such as your newsletter and weekly educational events and office hours?
Yes, I'm happy to. Alliant recognized that resources and educational events would not be a one size fit all. Across the 7 states we serve, nursing homes were identifying different barriers that were specific to their population and based on cultural nuances. And our resources had to address this in addition to educational events being flexible to the time constraints of leaders in the nursing facilities. As a result, we offered weekly education session and office hours that could answer questions live during the sessions, but then were also made available as recordings to view at times that were convenient for the facility leadership. We created a landing page where we can consistently add flyers, educational posters, and other tools to support leaders in overcoming barriers as guidance changed through educational tools. Monthly, we published a newsletter that was distributed via email with not only links to our tools, but also provided notification of upcoming educational events, but also linked to any CDC or CMS guidance or regulatory changes. Finally, on the website, we added what we call Take 5 educational events. These bite-sized learnings can be shared with frontline staff in small bites that are both easy to watch but fit in with their busy schedules. We tried to make sure our resources would work for everyone and anyone.
Thank you. Cassandra, before we close, what's one thing you'd like our listeners in skilled nursing facilities to know as they go back to their work in the facility?
I think education and communication would be the most important, to just keep those facts out and continue to keep those discussions going around the vaccines. And I'm glad that Lisa mentioned that Take 5 minutes for COVID education, because those were very helpful for us. And early in with Alliant, they had so many resources around infection prevention and around the vaccinations that it was very good for our staff to be involved in, and we were very appreciative. I thought that was very helpful for us in understanding there's so much out there now that we do really need for our resources to give us the facts, and I think continuing that education is helpful in the prevention with the vaccines and stuff and being able to continue those.
Thank you both for your time today. To our listeners, thank you for joining. Be sure to join us next time to hear more impactful interventions for increasing vaccination rates and reducing mortality in nursing homes.
To learn more about today's episode and to access all of the CMS QI Voices audio series and show notes, please visit qioprogram.org/CMS QI Voices. Thank you for listening to CMS QI Voices.